Now let's move on and talk about congestive heart failure. Now, first of all, it's very important we define heart failure. What does that mean? It means the cardiac output does not meet the metabolic needs of the body. Now, typically, in this scenario, the cardiac output is going to be decreased. However, in a little while, we'll talk about there are 4 or 5 conditions when you have so-called high output cardiac failure. But typically, when you have congestive heart failure, cardiac output is going to be decreased. And again, though, the key is it's not meeting the metabolic demands of the body. Now, very important, there can be so-called forward failure or backward failure. Again, if it's forward failure, that means, again, decreased tissue perfusion, right, which can lead to shock. Backward failure means what? The blood's backing up and going back up into the lungs and into the systemic circulation to the venous side, okay? You can see here, left-sided and right-sided can often occur together, but very important we talk about them separately so you can differentiate between the two on the exam. Now, very important, we talk about left-sided heart failure, that hypertension, ischemic heart disease, like a myocardial infarction we just talked about, can cause this, okay? Aortic or mitral valve diseases, also very important associated with it. Now, what happens is you're typically going to get hypertrophy of the left ventricle, particularly if it's hypertension, again, trying to push the blood past the increased afterload or peripheral vascular resistance. And again, at first, it may work a little bit, but the problem is you get so-called concentric hypertrophy, which means the entire wall is going to be thickened, and what happens is the chamber gets smaller. So now all the blood can get in the chamber, so what does it do? It starts to back up. And all the blood first, again, going back to anatomy, backs up into the lung. So it's very important when you have left-sided heart failure, your manifestations are in the lung. You see here, you see dyspnea, orthopnea, rales, paroxysmal nocturnal dyspnea, okay? So very important, left-sided heart failure, you look for respiratory problems, okay? Lungs, you here, are heavy as well as edematous. Now, also very important, like I said, with the left-sided heart failure is the fibers are going to be enlarged, and sometimes you get a description of the nuclei having a boxcar appearance. So you get a history of a boxcar nuclei of the myocardial fibers, think hypertrophy, okay? Also notice that because of the blood backing up into the lungs, you're going to get increased hydrostatic pressure, forcing fluid out of the capillaries into the alveolar spaces, giving you pulmonary edema. Very important. And typically with pulmonary edema, patients will present with a frothy sputum because the edema is a transitate and that low protein gets in the sputum and kind of froths it up. The other thing they get is this. The increased pressure also forces out red cells into the alveolar spaces. When the red cells are forced out, they lyse and hemoglobin is released. Macrophages in the lungs can act like Pac-Man and come in there and waka and eat up all the hemosiderin, giving you these so-called hemosiderin-laden macrophages or heart failure cells. So very important that pulmonary edema and heart failure cells are also a part of your left-sided heart failure. Again, you can see them right here, hemosiderin-laden macrophages and heart failure cells, okay? Now, complications, as you can see here, again, pulmonary congestion and edema we just mentioned, activation of your renin, angiotensin, aldosterone system, very important because of the lack of volume to the body. Again, giving you secondary hyperaldosteronism, and like I said before, maybe associated with cardiogenic shock, again, because you're not getting the perfusion of the tissues secondary to the problem of the left heart. Now, with right heart failure, number one, the most common cause of right heart failure is left heart failure. That's very important to remember for the step. Now, you see here, most common cause of left-sided heart failure can be associated with pulmonary or not tricuspid valve disease because they're on the right side of the heart. The other thing can cause this is so-called cor pulmonale. What does that mean? Well, again, cor means heart, pulmonale means a problem with the lungs. The key is you have isolated pulmonary hypertension. And so the pulmonary hypertension causes the blood to back up into the right side of the heart, and because of the pulmonary hypertension, you get right ventricular hypertrophy now, okay? So right-sided heart is going to be enlarged, and the blood eventually will do what? It's going to back up into the systemic circulation, giving you pitting edema of the lower extremities. You're going to get congestion of the liver, spleen, and the kidneys, and you'll get JVD, jugular venous distension. So very important, if a patient has right-sided heart failure, they're going to present with the pitting edema of the lower extremities, JVD, okay, as well as congestion of the liver, spleen, and kidneys. Very important for the step exam. And you can see it here. Also, I would note they get the pleural and pericardial effusions. Again, going to be a transudate, so be aware of that. Ascites, also a transudate. Again, when you're comparing transudates to exudates for the exam. Again, we mentioned chronic passive congestion of the liver, sometimes called what? Nutmeg liver, to be aware of that. And this cardiac sclerosis or cirrhosis just means that because of the long-standing congestion, you actually will get scarring around the central veins in the liver, and that's why it's called cardiac sclerosis or cirrhosis, because it's secondary to a problem in the heart.